When Gabriela was born, I didn't expect we have complications and they have to do an emergency C-section. And by the moment she born, I only see that she didn't have part of her face. And that was quite shocking. I didn't even comprehend what was cleft lip and palate. After we were released from the hospital, I remember I didn't sleep. I spent hours in the computer. We had the plan to go to 3 different hospitals. I went to the first one here in Florida, and I had a lot of bad feelings about the pre and post surgery pictures. So we took a second opinion, and the second hospital was Nicholas Children's Hospital. And that's when we met with the whole staff of craniofacial team, including Dr. Wolf. And by the first moment, it was like a sign to my heart that says, this is the place, this is where Gabriela needs to be.
When a baby is born with a cleft lip, cleft palate, the families, the first thing they want to know is, can this be corrected? And you know what they want? They want it closed immediately. So some surgeons will go ahead and try to close it immediately, shortly after birth, and we know that maybe we have better results scar-wise, but really putting the confrontation, the pieces, the segments together are not as good. And I can tell you that in our team, we'll never close a cleft lip before 3 months of age.
When they came for the first time, I saw that the parents are in shock. And I have a lot of experience with families, so I try to support, they feel comfortable, and we feel like a family.
They explained to you from the beginning, like, this is what we're expecting. The first surgery between 6 months or 8 months, depending on how the gap closed. And after that, she's going to receive her second surgery when she's 18 months of age.
We have the experts, the surgeons especially, into able to close this anomaly or difference that nature did not complete. And Dr. Wolf is world-renowned.
It was very scary. Fortunately, when she came out from the surgery, I was quite shocking because it's like they're giving me another baby. She was able to eat normal. She was able to go to the park with our family. And it's been 8 years already. And every single day that I look at Gabriela, I completely understand that she came to our lives to teach us a lesson, to be thankful, and to have faith. It was hard, yes, but it had taught us many good lessons and actually unifies our family. Because if we pass the situation, we can overcome anything.
My name is Rick Gradette, and I'm a pediatric plastic surgeon who specializes in caring for kids with cleft lip and palate and craniofacial differences. Cranial anomalies in kids are generally due to trauma to the head, fractures of the bones that make up the skull, or sometimes even when a piece of bone needs to be removed to operate on the brain.
Hi, my name is Eric Jackson. I'm a pediatric neurosurgeon at Johns Hopkins. The primary process of evaluation starts with a physical examination, with us looking and trying to determine what is the actual anomaly that we're trying to treat. Often based on that, we will recommend some sort of imaging study, and we have worked a lot with our radiologists to try to get the studies down to reduce the amount of anesthesia or radiation, either through low-dose protocol CAT scans or through limited MRI scans that avoid the need for anesthesia. So I think there's 3 main reasons why we would do surgery for a cranial anomaly. The first would be for diagnosis. If there's a lesion in the head or skull that we're not sure what it is, then oftentimes we like to get tissue to figure that out to know if there's any other treatment that would be needed. The second is for brain protection. Oftentimes if there are defects in the skull or the tissue around that, then the brain can be at risk. So obviously we would want to fix that. in order to protect the brain itself. And then lastly is obviously if there's any significant cosmetic deformity that's noticeable both to the patient and the family, those would be the main reasons we would consider intervention. The surgical treatment for cranial anomalies is going to depend on the anomaly itself. For instance, if it's a bony defect, then the surgery is primarily going to be the reconstruction. If there is an abnormality or a lesion that we have to remove, then the surgery will entail both the removal and the reconstruction, which is typically done in the same setting. For the reconstruction, decisions are made on a patient-specific basis due to a variety of options. For a very small defect, for instance, in an infant that's often growing bone very rapidly, we may actually leave it open and allow them to heal it on their own. For larger defects, we tend to do one of two options. One is using the patient's own bone, usually through what are called split thickness grafts, where we take their bone, split it in half, and then put half where we took it from, and then the other half to fill the defect. The other option is to use synthetic cranial implants that are made based on 3D imaging. For either of these options, we have the option of using permanent plates versus resorbable plates that will go away and dissolve over time, which tends to be a better option for our younger patients.
Multidisciplinary care is a group of specialists that have different but complementary skills, knowledge, and expertise that allows us as a team to really provide the best care possible for your child. The specialists in our team include a radiologist, a neurosurgeon, a pediatric plastic surgeon, and a craniofacial surgeon. State-of-the-art patient care is the focus of everything we do at the Children's Center. Our team of specialists really remains on the leading edge of not only patient care, but also research into treating children with cranial anomalies. We have kids that come from all over the world, the Middle East, Africa, South America, and Europe, to receive very specialized cranial care.